Hi, brother. You can now share your valuable experience as an academic doctor and also as a staff.
Teeth so bright, mirror whisper secrets in the morning light.
So, Dr. Bala, personally, what changes you received after this course?
A lot of confidence.
A pure delight, brushing like I'm painting on a canvas.
And tell me, what are the other things you learned at our Malligai Dental?
Mainly practice management.
And right, rinse away the worries, watch them take flight. My oral.
Okay, tell me about your digital dentistry experience. People want to know, like, what are the digital work you know?
So digital, I can do the scanning.
Baby, keep that smile shining. Floss, floss daily. It's our.
So, like, you saw patients, you learned yourself, then you saw a patient, you trained a dentist also.
Yes.
Tell me your experience about that.
So I'm already in a course, so I.
We're mining. Cavities and plaque, they don't stand a chance. Gargling, here we go, now let's do the dance. Tooth enamel strong like a knight's lance. Fresh breath warriors ready for romance. Minty fresh sensation makes me feel so cool.
Hi, brother. You can now share your valuable experience as an academic doctor and also as a staff. So tell me first in the academy what work you have done for us.
In the academy, I joined in August 2022. I came for just for RCT, but you recommended the competency course that industry which covers all the implants, infections, and also the veneers.
Which college you have graduated from?
From Malligai Mission,
Salem Vinayak Mission, and which year you completed?
2020.
So 2020 you completed, you came to me in the year 2022. Wow, so what you were doing in between?
So I was preparing for the meet.
Okay.
So, but the first time it got postponed due to COVID. So I tried, but I didn't get much. But so I thought of doing.
So he tried his level best to get a PG seat, he didn't get through. So immediately how you took a decision to come and do a course?
I can do another year for preparation, but I thought the clinical work is needed. So I can get some clinical knowledge.
So you want to get clinical experience and you came to...
Yes, sir.
Okay, Dr. Bala would have shared his individual course testimonies like ortho testimonies and other testimonies, but today he's completing all his tenure at Malligai and he's going. You know, the best thing is he's going to open his own clinic very shortly in his native place, Kangayam, and definitely he's going to be one of the best doctors in that particular town because I can certify him through my expertise that he is really very good in most of the work he is doing, and he's also good team member. Most of the team members, they really like him for his quiet speaking skills, soft spoken person he is, and he's very good in a team. So, Dr. Bala, personally, what changes you received after this course?
A lot of confidence. A lot of confidence in myself as well as in my clinical work.
Okay, give me one example for confidence. Like what exactly you mean by confidence?
Communication skill.
Okay.
So I'm an introvert, person. So I don't like talking much. So I have some anxiety issues.
Okay.
In public speaking. So that changed drastically after coming here.
So he is telling that he is an introvert and he has got issues in public speaking, and most of us have got this feeling. But I want to tell you, through training, okay, for you also, through training and practice, you can overcome your weakness. Okay, even I was an introvert. Okay, when I was a kid, so I understood one thing: if I'm an introvert, I cannot help many people because I won't be approaching anybody, and people will not come to me. Since if people know that I am going to help them through my communication skill, they will listen. For example, I started making videos. Then people know, okay, this guy is approachable, so they started coming to me. Introvert skills will never help anyone, even yourself. I'm not telling you have to be very talkative and all that. You have to be, you can be an introvert, but still, if you know how to communicate through training, it's well and good. So you became confident. And tell me, what are the other things you learned at our Malligai Dental?
Mainly practice management. What are the things that can go wrong and how can we correct it?
Give one example to the viewers.
So even if a chair broke suction tube, we have to fix it immediately. Otherwise, the next patient we can't go to it.
Maybe.
So we need to see simple things and fix it immediately.
So the moral of the experience is he's telling don't procrastinate. Maybe tomorrow we'll see. If anything goes wrong, correct it immediately. So you learned that here?
Yes, sir. And
You are not like that before.
after getting so much of clinical experience, I can claim it out.
Okay, tell me about your digital dentistry experience. People want to know, like, what are the digital work you know?
So digital, I can do the scanning
How many scans you have done?
over 100, more than 100.
He has done all my scanning monopoly. He's a monopoly, like nobody has done it. And almost 100 odd scans he has done within this last couple of months only. That's a good achievement.
Yes, sir, I can do.
You can write a book on it.
Okay, sir.
You can write a book, blog, reels, Instagram reels also. Okay. And also I want to appreciate his photography skills. Tell me about photography. What did you learn in photography?
Before coming here, I don't like that much. But after coming here, after playing the camera in my hand, I like it.
Lovely to the participants.
I can take the photos very much well, and I'm
Okay. See, I'm going to give a tip here. Okay. If you're feeling shy to talk to a camera, if you're talking to a public in a meeting, don't think 100 people are watching. Just imagine you're talking to one single person. Or see what image you bring in your mind will be reflected in your body language. If you think confident images, confident body language will come. Ultimately, focus on the message you are delivering, not on yourself. Shift your focus, it will help you. So when you're talking to patients, if you are very shy, patients sometimes can overrule you by using their skills. They will bargain and sometimes tell you something, right? It can happen, right?
Yes.
So definitely you have to be confident to the opponent. Then only you can always win the game. Even in fact today, there was a patient who was supposed to give me a very big amount. Patient said, work is not completed, why I beg you? But the thing is, we have already spoken to the patient that this is the deal, you have to pay in advance. We will do the work only in 2 months' time. It's an implant case. Patient always will try to take an advantage. Because any customer will always try to put something advantage to them also. But if you are honestly communicating in person before, you can very well tell that I have communicated already this and we are following our policies. Otherwise, if you lose a patient and patient doesn't pay you, you have to keep following them up. Am I right?
Yes, sir. Sure.
So be strong in communication. Communication will win you a lot of money, name, fame. Okay. We have here a nice book. Okay. So this book is the work done by our dear friend. Come doctor, come close. So our doctor has done work. So he has written a small testimonial about thanking me, and he was telling about his story. Okay, see how nicely he has done. I'm very impressed. And these are the cases, RCT cases, and his implant cases. Everything is here. He has done a nice documentation about the clinical picture, pre-op X-ray, post-op X-ray. The Bala, how is RCT experience for you?
Around 30 hours it is in sir.
Mhm.
I can do
You can do now RCTs confidently?
Yes, sir. Sure.
Are you happy?
I'm happy, sir.
See how many cases he has done. Let's go to our implant section. This is implant section.
Yes, sir.
It's a lot of pages are there. If anybody wants to see his work, you can come to our clinic and take this book and see for hours and hours. You can see how he placed these implants. And so tell me about your implant course experience. How do you feel, doctor?
So, implant was my first course.
Mm.
So,
Feel happy?
yes, sir. I feel happy.
See, nicely he has done parallel. So you have to be thankful to all these uncles and aunties who volunteered.
Yes, sir.
Okay. Are you happy?
Yes, sir. I'm happy with it.
So, and I would like to tell Dr. Bala was even guiding and mentoring the new participants after his course. He's like, say, third year PG. At the second year PG, the first year PG comes, they only will guide. So likewise, Bala was fully with young doctors who came for implant and who came for impaction. Tell me how they perceived you. Hey, Adi, was ரொம்ப நல்லா பண்றார், like Did that feeling gave you a nice thing? Like this academy gave you an opportunity to even train another dentist. So like you saw patients, you learned yourself, then you saw a patient, you trained a dentist also.
Yes.
Tell me your experience about that.
So I'm already in a course, so I know what they're expecting and what they wanted to know. So I know the things. So I explain that clearly first, and then I do the clinical work, and then I let them do the work, and just do the corrections of what they are doing and compare.
Okay. So he's telling since he was a student, he was able to understand the minds of the students, and he was able to guide accordingly. See, that is why they say a good teacher is always a student. Okay. Coming to the final part of our thing, tell me, you worked in a very nice setup, and are you going to have a setup like this in your practice? Like the standards we have, the ambience, interior. You should never compromise even 1 point below. Okay? Don't think of your limitation, think of your goals, and please work hard. Even you can get money, do better than this setup. You should never go below this. Promise me that. Okay? You have promised that you have to spend a lot of money now to put nice AC, nice interior, because always our standard should never come down. Okay? Okay, the final question. You have invested a lot of money as a trainee for the comprehensive course. Tell me this. Is it really worth it now?
Yes, sir, it's really worth it.
It's really worth it. This guy was our first comprehensive course doctor, and doctor trusted me blindly. That's all I can say. See, if you ask me before the course, like if course is there tomorrow, I won't be able to tell you anything. But after 6 months, you know exactly where I have taken you. You are right?
Yes, sir.
The day you start, you may be totally clueless and no confidence. But after so much of cases you do, you get complete confidence. I wish you all the best, buddy.
Thanks, sir.
Thank you for all your love and affection on us, first of all. And thank you for your trust on myself, my people, my patients, everything. We really salute you for your service. Okay? Take my salute. Okay? So thank you for your valuable service at Malligai Dental. And we promise you that we will keep praying for you.
Okay, sir.
Whenever we pray. Because all our prayers and blessings are every day. Almost we pray and we bestow our blessings on you. And also, we wish you should work really more harder and reach more higher levels. More degrees, more courses, more international trips, everything. Okay?
Okay, sir.
Promise me that.
Promise.
You have given a lot of promises. Don't fail me or fail our academy.
Okay, sir.
And be a shining star wherever you go. Be very unique. Be excellent in your profession. Be very, very sincere. Be a very good person. Be very humanistic to patients and your team. And by the way, all our nurses love him because of his hair and also his brains. Very quiet and very lovable person he is. Love you, boy.
Thank you.
And finally, when I went for my first trip, all my documentation was done by him. My visa work, everything was through. No failure, nothing. Okay? My personal thanks to you for that.
Yes.
Okay? Okay. Love you, man. As a family, even my wife, children, they know you. So they were very happy to know that you're completing your tenure and going. Okay?
Okay, sir.
Thank you. Do this. Take on photos on there.